Diabetes symptoms. Diabetes mellitus. Type 2. Diabetes signs and symptoms. Diabetes warning signs. I'll be discussing the early signs and symptoms of diabetes. It's important to understand the two main types. Type 1, where insulin is completely absent. Type 2, where either insulin production decreases or the body becomes insulin resistant. And gestational diabetes, which occurs in pregnant women without a prior diabetes diagnosis. Early signs of diabetes. Number 9, hunger and fatigue. The food that we eat is converted into glucose, and this glucose is utilized by our cells for energy, but our cells need insulin to take in glucose. And if the body doesn't make enough any insulin, or if the cells are resistant to insulin, then this glucose can't get into them, and you have no energy. This can make you even more hungrier and more tired than usual. Number 8, peeing more often and being thirstier. Being thirstier, a person with diabetes may need to pee a lot more than an average person. Normally, your body reabsorbs glucose as it passes through the kidney. But when the blood sugar goes up, as in the case of diabetes, the kidneys may not be able to bring it all back in, and this causes the body to make more urine, and this takes more fluid. So this will make you very thirsty, and you will drink more water. So when you drink more water, you will also pee more. Number 7, dry mouth and itchy skin. Because the body uses a lot of fluid to make urine, there's less moisture available for other things, and this can make you dehydrated, and your mouth may feel dry and dry. Skin can make you itchy. Number 6, blurred vision. The changing fluid levels in the body can make the lens in the eye swell up. And since the lenses change shape and can't focus properly, our vision is blurred. Let's now take a look at the symptoms of diabetes. The symptoms appear after the glucose level is high for a long time. High glucose, the symptoms include fungal or yeast infection. Number 5, fungal infection. The fungal infection may be seen in both men and women who are suffering from diabetes. The excess glucose in your body promotes this fungal infection, and these infections can grow in any warm, moist skin folds that include between fingers and toes under the breasts in or around genital organs. Number 4, slow healing source or cuts. So over time, high blood sugar can affect the blood flow, and it may even cause nerve damage. So the affected blood flow and nerve damage make it hard for your body to heal wounds, then pain or numbness in feet or legs. Number 3, pain and numbness. Pain and numbness are also a result of nerve damage caused by high blood glucose. Number 2, unplanned weight loss. If your body can't get energy from the food that you consume, then the body starts to burn muscle and fat because it requires energy. And because it is burning muscles and fat, this leads to unwanted weight loss. Next is number 1, nausea and vomiting. Now, when the body burns fat, it makes ketones. These ketones can build up in the blood to dangerous levels when the body keeps on making ketones. And these ketones can make you feel sick. So it is the ketone accumulation that causes the feeling of nausea and vomiting. Warning signs of diabetes. Complications. Now, diabetes is a disease that can lead to certain complications, and the signs that can act as a warning for these complications include first, slow healing source or cuts. Second, itchy skin. Usually, it is around the vaginal or growing area. Third, frequent yeast infection, or you can say frequent fungal infection. Then recent weight loss, numbness, and tingling of the hands and feet. Decreased vision impotence or erectile dysfunction. A serious complication of prolonged increase in blood glucose is diabetic coma. A diabetic coma can even lead to death. It may occur with either type of diabetes, though it is more common in type diabetes. It happens when the blood sugar gets too high and your body gets severely dehydrated, and its symptoms include first blood sugar above milligram per deciliter, dry parched mouth, extreme thirst, warm, dry skin that doesn't sweat. You may even have a high fever, sleepiness or confusion, vision loss, hallucinations, and weakness on one side of your body. So these are some warning signs that would indicate a pending diabetic coma. When to tell a doctor. So when do we visit a doctor? Or when should we consult a doctor if you are older than 45 or you have any other risk for diabetes? You must get tested when you spot the condition early, so you can avoid heart trouble, nerve damage, and various other complications. So as a general rule, consult your doctor if you feel very sick, weak, and very thirsty, if you are peeing a lot, if you have a bad belly ache, if you are breathing more deeply and faster than usual. Hope you like this video, and if you do like this video, do like, comment, and share this video. Thank you.